Hi, this is Jamie Hadfield with Legends Health, Wellness, and Performance podcast. Today we're in American Fork with Dr. Carmel Ferreira, and she just opened a clinic called Empowered Healing. It's Empowered Healing Center.
Correct.
And you have, I noticed when I walked in, you have a kind of a logo that has 3 different sayings.
Correct.
With empowered health. Can you explain that for us?
Yeah, so the business model is empowered healing, empowered health, empowered you. And so when I was thinking of, the clinic name, when I knew I wanted to create something, I was thinking of all the people that walked through my door and some of the concerns that they had. A lot of them were definitely physical symptoms, but the majority of them were also bringing with them mental, emotional, symptoms, health concerns like depression and anxiety. And I think I had mentioned to you that that's a great deal of the patients that I tend to see. And so oftentimes they just feel that they have no hope. And I was thinking, what can I do to make them feel empowered? And so here I was just thinking of all these names and then all these things. And then it finally hit me, well, I want them to feel empowered because I want empowered healing. I wasn't really thinking that was going to be the clinic name, but until it hit me, as I said, I'm like, empowered healing, empowered health, and then I want the person to feel empowered, so empowered you. And so then that's how it kind of came together.
I absolutely love it because I think that's what Legends Health, Wellness, and Performance is all about too, is empowering the person to be have better health, be a better person, contribute to the world in a better way. So I absolutely love your slogan. So you just said that you see a lot of depression and anxiety, and I would think that most doctors, especially in today's society, are seeing a lot of people that are coming in their door with depression and anxiety. How do you treat that? And what's unique about how you treat that, I should ask?
Yeah, so the reason why I'm getting a lot of patients that have these symptoms is because they hear from other patients and other individuals that I do treat it a little differently. And so I actually have a story to go with it, because it kind of ties back on how I actually was able to find out that I had Crohn's. And so with that being said, as far as how I treat anxiety and depression, I'm looking at the whole person. I have to look at the whole person, because if I don't and I just concentrate on the symptom, I'm just like any other conventional doctor that might just have you in for 10 minutes and out you go with the prescription. And that's not what I'm looking to do. I'm looking to find the cause of the anxiety and depression. And so oftentimes after I do this detective work with a lot of the comprehensive labs that I'm running, I'll see that some people, it may be a hormone imbalance. For some women, it's sex hormone imbalance. They've had multiple births, and so now they're just trying to recover their own body, from everything they've given to their children. I'll even see that with men as well, that their hormones are depleted and they're experiencing depression and anxiety. And oftentimes men don't like to talk about it. And so that's what I'll notice there. There's also a thyroid imbalance. That's what I'll sometimes see. Maybe someone has Hashimoto's, which is a autoimmune condition of low thyroid functioning. That often is a cause of depression and anxiety. And food allergies is a huge piece. And that's kind of where, I think I was talking to you before about my story. When I was figuring out what was going on with me, I was experiencing severe anxiety, when I was in med school. And then, lo and behold, as I dug a little deeper, I ended up realizing it was more, definitely a lot of food allergies, and then just irritation to my gut, which caused then that anxiety to just become more dominant until I went ahead and fixed that. And like I said, that's how I came across the diagnosis of Crohn's after much searching and digging. So
let's go into your training for a little bit, and then let's go in and talk about your Crohn's disease. Where did you go to school?
So I went to school at Southwest College of Naturopathic Medicine, and that's the naturopathic medical school. And so there's 3 physicians in this nation. There's the conventional doctor, which you see MD behind their name, and they're going, to a conventional medical school. There's also a DO, a doctor of osteopathic medicine, and they go to their own proper school as well. They don't go to a conventional medical school. They go to a school that has their own curriculum that emphasizes on their philosophy and also what separates them from the conventional doctor. And then there's my profession, which is naturopathic physicians. And so we go to our own proper school with our own proper curriculum. And so all our schools are still 4-year based, and we still do the clinical sciences and do also a lot of the, typical, pathology, laboratory, all these classes. So that doesn't really change. Mm-hmm. All of us in our first 2 years, we're doing the basic sciences. And after that, we take our own set of boards, to go ahead and make sure that we're competent enough, to know the material, because science is the understanding and the basis of medicine. And so we want to make sure that, anyone who's going to be a physician understands that, because biochemistry is everywhere. And so you need to know that. And then after that, that's when we get into all these other courses that are now kind of weaning us and training us to be a physician. And after that, we conclude with, graduating and then taking our own set of clinical boards. And so that's where the background is. But before going to medical school, I actually did a background in sciences. So I was doing medical research prior to going to medical school. And so I went to the University of California, Santa Cruz, and I studied molecular, cellular, and developmental biology. So I was able to do basic science research. So basically we're talking about, in doing things from bench work all the way to the animal model. So I tend to work with, I work with a lot of rats and a lot of mice, and then got to see how I was working in the live model. It might have worked on the bench, made sense there, but then I took it to the animal model and seen how I was working there. And so that was basically the background. I also did do my master's in acupuncture when I was in medical school. So I was doing it simultaneously. And it's just because I wanted to go ahead and get it over with. And I thought it was also a great compliment. It was a lot of work, very intense, but I was able to get my master's in acupuncture because I wanted to provide the best set of tools for my patients, because I just wouldn't know what I would see as soon as I was in practice.
So, but you also call yourself a functional medicine practitioner. So do most naturopathic physicians call themselves a functional medicine practitioner?
I think it depends on the practitioner,
okay.
But in all reality, all naturopathic physicians are functional medicine, because the basis, or I guess the definition of functional medicine, is we're looking for causes. And that's really the principle of naturopathic medicine. We're looking for reasons of why you're experiencing a certain symptom. We're not looking to treat that symptom, individually. We want to see and understand the whole system, the whole person. And so that is functional.
Okay. Thank you for that explanation. Yeah. Okay, now let's talk about your Crohn's. Did you develop that when you were in medical school?
So, looking back, I don't think I developed it in medical school. I probably, had it early on, just because I could think of times, when I was younger where it just kind of stood out, and I was like, oh, well, but at the time I wasn't really, knowledgeable of what it was. It was in medical school where I discovered now the diagnoses that went along with it, because I'm the atypical Crohn's patient. You look at me, you don't really think that I have Crohn's. And so I remember it was in my second year, and at that point, like I said, I was doing both my master's and medical school at the same time. So Monday through Friday, during the week, during the day, I'd go to medical school. Nights and weekends, I would, hustle off onto, to my acupuncture school, and then do my master's then. And so things got a little intense. I was also working minimally part-time.
Oh my goodness. I don't know how you handled that all.
With an autistic patient. I think it was my saving grace, because it started making me think a little differently on how to approach my situation. Because I had gone to, the school clinics, and let them know what my symptoms were. And everyone right away was like, well, you're in 2 professional programs at the same time, working part-time, you're going to experience anxiety. And I knew that. I wasn't saying that was like, no. So I understood. But I knew that there was something else going on, because I know my own body. Kind of like when I hear some patients say, I'm experiencing this, but I know this is, X, Y, and Z, but I know there's something more. I want to believe them because that's where I was. I knew something else was going on. And so after a while, I was like, okay, well, I've done everything right. Because, you know, if you go to a naturopathic medical school, you're going to find all the students there eating great. They're not eating
They're not eating fast food.
Yeah, they're not eating your sad diet. You know, everyone's doing great. Everyone's taking their supplements. People are doing everything they possibly can because you really become your first patient. And so I was like, wow, that's interesting. I already eat a good diet, so what could be going on? And then it just kind of gave me like, you know, a little like, I had an epiphany, you know, when I was working with a little boy that I was doing, you know, some autistic therapies with him. And I was staring at him one day and I realized, wait a minute, autism is on that anxiety spectrum. And I was like, okay, well, you know, usually what are the things that we do with autistic patients? And what were we doing with this little boy? And I realized what we're doing is we're removing gluten and also dairy completely. I already was eating both, but at a very minimal amount because I never really felt well with it growing up. But nevertheless, I was still eating it. And so just a small amount can actually have a lasting impact. Like a small little pea-size amount can have like an impact on your immune system for the whole week. And so then that's when I was like, all right, well, let's go ahead and then completely remove it. And then also do some colonics and then just clean the system out and then see how I do. And so I started my own little path of, you know, doing what I would have someone else do. And then that's when all of a sudden I was feeling great. But I wasn't really catching it because, you know, you're living your own daily life. You're not really noticing it. You're going through your emotions. And then that's when I remember going to a pharmacology exam. Very prepared, so I felt great, and I just wanted to like calm myself a little more. And so I was drinking a kava tea, and I had just bought this kava tea, the kava tea, just I think the day before, and so I wasn't paying attention to the ingredients, and so I ended up having a cup, and for some reason, all of a sudden, I started feeling more anxious, and I'm like, why? Like I'm prepared for this exam, like I have no worries. Yeah. And so I remember feeling very panicked, like, basically it ended up being a panic attack. And so going to my, professor for, pharmacology, Dr. Woolner, and I walked in and then she looks at me. She's like, you don't look well. I'm like, I'm not well. I don't know what's going on. And so then I spoke to another professor and she's like, well, what did you have? And so that's when we figured out there was a little bit of gluten in that tea because of the barley. And so then I knew how sensitive I was to it. And so during this time, now things are starting to make sense. Like, okay, so there's definitely some allergies present. And so I decided to go to a different practitioner, someone outside the community, so then they kind of saw me without the, well, of course you're in 2 programs, and doing a part-time job that causes anxiety. And then I started relating to him all the things that I've started to learn while I was already, doing well, and then things that had gone bad. And, I was very fortunate to have had him, take into consideration what I was asking, if he was willing to go ahead and run a couple tests, for me, and what I was thinking. And he knew I was a naturopathic medical student. He was a doctor of osteopathic medicine, so he was very much, accepting of what it was that I was studying. And so lo and behold, that's when I was able to get a, referral to a gastroenterologist, and we were able to do colonoscopy and an EGD, and then that's when I got the diagnosis of Crohn's. So when I was coming out of the anesthesia, I recall that, a nurse came to me, right away. And she wanted to know that I was well, which was nice. But then also, I think her agenda was more so, I have this prescription for you. And I'm like, oh, what's the prescription? And so then she's like, oh, it's prednisone. And I was like, oh, okay, well, can you tell me like why I'm getting this prescription? And she couldn't disclose. She's like, I'm the nurse. You have to talk to the doctor. And I'm like, well, can I talk to the doctor? She's like, well, you're going to have to get, an appointment with him. And so they set up your appointment then, on the spot. I think it was like scheduled out for like 2 weeks, which was the typical. But I want to say it was either the next day that I got a call from them right away saying that they wanted to see me sooner. And so I knew something was going on. At that point, I didn't fill my prescription for prednisone. because I figured, you know what, if there's inflammation, I have tools. Naturopathic medicine has tools on how to go about on decreasing that inflammation. I just now need to understand what the diagnosis is, so then I could go ahead and then move forward and treat it appropriately. And so when I got called to come to the office sooner than my expected appointment, I knew something was going on. And so I went ahead and made that appointment as what they suggested, and then went to the office. And as I sat in the waiting room, I figured, you know what, I should probably figure out what it is before I go into the doctor to see him. So, you know, I asked, can I have a record of my report? As I wait here for the doctor, they had no problem. They gave me a copy of what, you know, he was going to go over with me. And then that's when I was reading the report, and lo and behold, I'm like, okay, Crohn's. So now I know. And so when I went in, the physician didn't really know who I was or remembered who I was, and just quickly glanced at the file, you know, flipping to the page of the report. And that's when he read it briefly. And so at that point, I'm already sitting there thinking, well, I already know what it is. It's Crohn's. You're going to tell me I have Crohn's. And so then he's like, oh, okay, I see. And it looks like you have Crohn's. And there was no emotion. It was more of going through the motions on his part. And I understand that's how the system works. And so he, you know, wrote a prescription and told me this is what I need to do. This is what I need to take. And it's very important because this is a very serious condition, you know, and, you know, off he went. He didn't really explain too much of what, you know, my condition was. And luckily I knew what it was. And then didn't give me any dietary suggestions, lifestyle recommendations, nothing. It was just more, here's your prescription and go. And so as I drove home that day, I remember thinking, okay, well, this is a big deal. And so what am I going to do? And so, you know, that's when I was like, well, you're going to do what you would tell any patient to do. That's what you're going to do. And so, like I said, I was already eating a clean diet. So when I went home, I went ahead and started going through my pantry and then got rid of a lot of foods that were polysaccharides, because I decided to go and follow the SCD diet, the specific carbohydrate diet. And so then that's when I started really cleaning things up. So all my chocolate went away. I gave it to my classmates. All these things that, you know, I knew would just be a little harder for my gut to handle during a time of just, you know, intense therapy that it needed. Because the severe ulceration, as it read in the report, led me to know that it was something I needed to take seriously. And so that's basically how I started on my journey of becoming my first patient.
So let's explain what Crohn's disease actually is, and what you wish that physician would have told you versus ulcerative colitis. What is actually the difference between the two diseases?
So with ulcerative colitis and Crohn's, they're the only two that are on the irritable bowel disease. And so they're autoimmune conditions. The ulcerative colitis, that usually is dealing with the lower GI tract. So we're seeing that more in the large intestine, whereas Crohn's is more dealing with the upper GI. So we start dealing with the small intestine and sometimes even into the the stomach lining and the esophagus. And so those are the things that separate the two. It's more so where are we seeing the damage and the ulceration. And so
it's more sporadic.
Correct.
It's more sporadic. Yeah. The ulcers are sporadic and not just an isolated set of the descending colon.
Correct. So it's more upper. And so on mine, it was in the small intestine. The small intestine is what then now put me into Crohn's. And so that can be detrimental because a lot of our nutrition is being absorbed in that area. And so if you're not absorbing properly because there's just these holes, this irritation, then it's going to be challenging to allow your body to have the vitamins and nutrients necessary for everyday function. And so I wish, that physician, even though I had that knowledge base, it made me sad to see that he didn't explain that. If I wasn't in medical school at that time, I wouldn't have known. There was no explanation of what you need to do for your diet. It was more so continue to eat what you're normally eating. He didn't even know what I was eating to begin with.
Didn't even ask.
Didn't ask. And so if I was eating a very poor diet, with the typical, standard American diet of every fast food that you could think of and drinking a ton of pop on a regular basis, that's just causing that Crohn's to get worse and worse because it's not allowing an environment for healing.
So let's back up, because any autoimmune disease starts on the 3 pillars. 1, you have to have a genetic predisposition for it. 2, you have to have what you're talking about, some type of intestinal permeability, which is leaky gut, but in medical terms we call that intestinal permeability. And the third thing is we have to put environmental type toxins into our system. So if we're doing those 3 things, that can lead us to having autoimmune disease. And from my understanding, the majority of autoimmune diseases can be reversed.
Correct.
If you focus on some diet and some environmental and lifestyle changes. Do you agree with that?
I agree with that completely. And so in my situation, I do have a genetic predisposition. There is definitely no doubt about that. Early on when I was younger, I, had symptoms. In hindsight, I could look back and I'm like, that's what that was about. Yeah. Unfortunately, my father passed of autoimmune hepatitis. So that genetic predisposition is definitely there. And so as far as the environment, even though I was a naturopathic medical student and doing well with my diet, that doesn't necessarily mean before school and before my passion for this kind of medicine began, it doesn't mean that my diet was perfect before.
Yeah, right. So it's an accumulation. That's why I want the audience, it's really important that it's an accumulation over the life, from even if you were breastfed, if your mother bottle fed you or breastfed, or if she was in a state of anxiety when she was having her pregnancy.
Correct.
that could carry over. Then it's kind of an accumulation. How many antibiotics were you on as a child, and what was your what traumas that were in your life, that kind of, all of that is an accumulation of things that you as a physician now look about to try to kind of go back and restore so that they can reverse their disease.
Yeah, because in my situation, my mother had me through cesarean. So that means I wasn't passing through the birth canal and not receiving that, immunity. So that was already one problem. I wasn't breastfed, so definitely another issue there. And then when I was a teenager, I had acne. And so what's the solution for the conventional medicine to provide for acne? Let's just go ahead and put you on an antibiotic for a very long time. So it was until later on.
And that destroys the gut.
Correct. So as time went on, and I became more, in my, during my college years, and that's when I started realizing, wait a minute, this is not good. And so then I started trying to change things around. It was just more so because of the passion of trying to understand, the natural side of medicine, because that passion, kind of started when I was younger, but it just kind of evolved, into different aspects of what now is naturopathic medicine for me. Mm-hmm. So, but yes, it did all start with an accumulation of issues, growing up, my family, we were exposed to pesticides. I grew up in Bakersfield, California, where it is, known for feeding the nation, agriculture. And my parents worked in the, fields. And so that, environmental exposure is present. So there's so many things that, made me, in hindsight, say, okay, well, this makes sense on why, we were able to wake this particular condition. It was that intense stress from being in 2 programs at the same time and also, working part-time. That stress only was the straw that broke the camel's back. So it was just more so it finally woke. So as far as reversing things can be reversed. We could put things into remission. So, I've had a couple patients even ask me too, I have Hashimoto's. Does that mean that I'm going to have Hashimoto's for the rest of my life? And my answer is yes, but it doesn't necessarily mean that it has to be active. It just means that we could put it into remission, we could put it to sleep. And so that's the difference.
You just mentioned, I want to quickly talk about pesticides because you just mentioned pesticides. I've recently seen on the internet and quite a few things that are coming across. Really, when we're saying pesticides, in my world, I think of glyphosate. Is that what you think of when you're thinking of that? And I saw a really interesting thing on the internet because it had all the different foods from cereals to any of our box foods, that glycophosphate was almost in everything. But they're not necessarily putting that on the ingredient deck when they're listing foods. Can you explain why?
I wish I had an answer for that one.
Yeah.
I really don't. Most of the time, because things don't get listed, it's more of a politics conversation.
Sad.
It's very sad, and so it's the same thing too. It's also marketing. Now when there's buzzwords, people want to emphasize on those buzzwords, but also discreetly not tell you some of the other things, and so, yeah, I really wish I had an answer for that one, but I don't.
Well, I've been doing some research and just in regards to ingredients that come on foods, and castrum comes up too, and really that comes from beaver secretions. But they put as a natural food substance when they put it in the ingredients, and really you're taking a beaver's secretions, and that's what they call a natural food. And so really check your ingredient deck, and because I feel that's so critical when you look at the ingredients, and when you look at the ingredients, how the industry does it, is they put the highest ingredient or the highest amount first, and then the least amount on the bottom. And so it goes in order, but they don't have to tell you the amount. It just goes in order. And I feel like, unfortunately, when I went, in grade school and high school, and I will actually even say in nursing school, they never taught me the ingredients. That was something I had to learn on my own. In naturopathic school, do they actually go into a depth about that?
Yes, they do.
Yay!
Dr. Mona Morrissey would be very happy to hear this if she was watching or hearing. And so, yes, we do. In our curriculum, and this is what separates our school from the osteopathic school and from the conventional medical school, is we have courses that emphasize nutrition. So we have courses also where we're talking about reading labels and understanding labels. And so oftentimes I have a little mini tutorial, in my consults with some of my patients when we're talking about fish oils. I'm like, you need to understand how much fish oils it is because marketing is tricky, and they're going to tell you 1,000 milligrams of fish oil in the front, but they don't tell you really how many omega-3s are in there, and so you have to do a calculation. So in our schooling, we are taught that, and they really go into it because they want us to understand, so then we could also become the teacher for our patients and help them understand as well.
Oh, that is, I love hearing that. I absolutely love hearing that. Okay, now let's kind of go a little bit more. I think we got off track a little bit. With a Crohn's disease, let's specifically talk about the diet a person on Crohn's disease needs to be on.
Correct. So I, did the specific carbohydrate diet, and so also known as SCD. And so in that particular diet, we're removing grains. I did more
than gluten, so gluten correct. And grains.
Yes, exactly.
Okay.
But I did more of a modified diet of it, and it was called the GAPS diet, Gut and Psychology Syndrome diet. And so it takes the SCD diet and then modifies it by removing all dairy. And so it is more of a paleo-like diet, but the difference between paleo and then GAPS is that there are legumes that you can eat. So in paleo, legumes are usually not an option. It's usually, meat, vegetables, fruit, nuts, and seeds. Mm-hmm. But in the GAPS diet, legumes are, allowed. It's just a matter of also, what types, which ones are doable, which ones are not going to be very harmful to the gut, because the gut in a disease state where it needs the nourishment and also just, healing those wounds, it's kind of like cutting yourself, right? And then you kind of splurge some like lemon juice over yourself. It's going to hurt, it's not going to be pretty, but versus, a healed arm, you spritz, lemon juice and you're fine. And so that's why that, irritation is important to remove those irritants. And grains are just so hard for the gut to digest that removing the grains is usually the best thing to do initially for those individuals that are experiencing any kind of IBD, ulcerative colitis or Crohn's.
Okay, so let's kind of take this one by one. With the grains, the grain industry, from a marketing perspective, they can say gluten-free is barley, wheat, and rye. And that is what you see at the market in the grocery stores, is when it says gluten-free, it's barley, wheat, and rye. But what I'm hearing you say, and in the research that I know, that we know that rice, oatmeal, and arrowroot all have a different type of, they have grains in them, but it's not called a glutenine.
Correct.
And the research that we have when we say gluten-free, we're just meaning a glutenine. Correct me if I'm wrong.
So yeah, the gluten protein is not going to be found in these gluten-free grains such as rice, or for that matter, I'm just trying to, I'm going blank right now.
That's okay, yeah.
Yeah, but on anything that's usually like gluten-free, there's usually going to be some grains still.
Okay, but that can, the grains, this is what I wanted from my research that I've done. Grains still have some type of gluten in them. It's just zonulin or a different type of gluten that we don't actually call gluten. So grains, and also grains can what we call molecular mimic gluten.
Correct.
And we need to watch out for the molecular mimicry, because that can put our body, and the reason we want to stay away from grains is because we want to stay away from inflammation. It causes inflammation, which opens up the lining of the gut.
Correct.
And then that is susceptible for any type of autoimmune disease. In your case, that was Crohn's disease. In my case, that was chronic idiopathic urticaria. That's went through the skin with years it stayed in the gut. Is that correct?
That is correct.
Okay, so why, in your words, why is grain so bad? What did the industry do to grains?
The industry has changed grains from what they normally naturally were. And so I've had even patients mention how they've gone overseas, and some of the food that they can't eat here, such as gluten, when they go overseas, they're not having that same inflammatory response. So the industry has changed what we eat. And why is that? That can go into the conversation of then now we're having, a lot of these crops being mass produced. And it's also about then also, putting some pesticides on there, also changing the seed formation. So we're talking about genetically modified and engineered seeds. And so it starts changing things completely. And then when we look back at my background of, science, when I was in the lab, you could easily, I'm sure, put some of these proteins, from maybe ancient times to those foods that are now, and then just look at their protein fingerprint, which would be in a gel, in the lab. And we would be able to see that they are very different. They're not the same. They may be called the same, they may look the same to us, but when we're talking at a molecular level, things have definitely changed.
Another way that I think I try to explain that is genetically, we were able to modify wheat faster than our body has evolved. Right, the evolution of our own bodies has not evolved. Technology got to us such that we were able to change the plant faster than our body could evolve to it, and that's why so many people are having an inflammatory response to it. That's how, yeah.
No, it makes sense.
Yeah. Okay, so the next, I think we've covered dairy. Or is there anything? Gluten. Is there anything else you want to kind of say about gluten and grains?
Well, dairy, if we're going into dairy, is very similar also to the gluten protein. And so that's why often they don't do well. If someone has an intolerance for wheat, oftentimes they tend to have one also for dairy because the protein tends to look very similar.
Okay. I know they also put a lot of antibiotics in our
yes,
dairy.
And hormones.
Yes, so
let's not forget those hormones.
Okay, so how does that affect our body? Because because I want to hear your response of how
Yes.
that affects the body.
So with the dairy, when, if someone wants to do dairy and they, this is outside from like, ulcerative colitis and Crohn's, but, individuals that can't handle dairy, oftentimes you don't want to do the conventional dairy that has the hormones. The cows have been given the antibiotics. The reason for that is because it starts affecting us. All these antibiotics then, are killing the natural microbiome, environment in that particular dairy. It also starts affecting our microbiome. And then aside from that, the hormones that these cows have received, now we're going to be getting those hormones, and it's going to start looking like, some hormones that we are supposed to have. And so there's a little bit of confusion in our body. So we're start seeing an imbalance of both, the microbiome and also our own sex hormones.
I also heard, I come across with dairy is, well, in America, we have to pasteurize our milk. In other places in the world, we don't have to pasteurize our milk. And when we do pasteurize, we have to pasteurize to 162 degrees Fahrenheit. Well, when we do that, and usually we do it more than once, we do it like 3 times. And when milk goes through that process it kind of destroys any vitamins and minerals that actually is really healthy for our body. And then what do? We end up fortifying it and putting in supplements because we've removed them all with the pasteurization process.
Yeah, and they're usually supplements or forms of vitamins that we can't really absorb. Folic acid being a very, good example. That's a, synthetic form of folate. We don't really absorb folic acid too well. I understand why the industry has done that, because we wanted to prevent spina bifida. But if you're not really absorbing it too well, it's going to be challenging, even if it is fortified. And so looking for those natural sources of the vitamins is important, which is also another, goes into the question, or more so the topic of when I'm having patients look at their supplements, making sure they're getting the right form. And so with folate, it tends to be, I want to see that you're getting methylfolate, because then it's going to be more absorbable versus the folic acid.
Yeah, that is a big topic as well as methylation. But let's stick on with dairy. If I go for another point for me on dairy is vitamin D. We are told, right, that Olympic athletes go, okay, you can only get your vitamin D through dairy, and it makes your bones strong. And can you kind of go into the importance of vitamin D in the body? And because in my opinion, I believe that I can get vitamin D through the sun and through spinach and chard and a bunch of my green leafy vegetables and through weight training and stimulate that vitamin D. But I do know how important vitamin D is in your body. So take it from there.
Yeah, so vitamin D is funny because it shouldn't even be called vitamin D. It should really be called like hormone D or something. Because, as humans, we don't make vitamins. We actually make hormones. And so vitamin D is so important because it works with our cognitive health, cardiovascular health, and also immune health, which is why when winter comes or even fall comes, everyone starts getting sick, because now the sun, which is helping us create that vitamin D, it starts to go down. And so it is a very important thing. But once again, now the fortified version that they're putting in, not quite ideal, not quite absorbable. And so oftentimes, getting it from sunshine, number one, right? But not everyone can live out in the sun all day, every day. And so supplementing it with the right form is also a very important thing. Oftentimes combining it with vitamin K is going to be more beneficial and absorbable.
Great. Let's talk about legumes, because you mentioned that was the difference between the GAPS and the SCD is eliminating, is that correct?
Paleo.
Yeah, paleo was eliminating legumes. And from my research on that sometimes if we'll soak our own legumes for 24 hours and we kind of sprout them ourselves. That's actually healthier than if we go buy a can of, let's say, kidney beans in this example. But I know that there is the importance of lectins, and lectins aren't really necessarily great for our bodies.
They're very inflammatory. And so oftentimes when we're eating these legumes, if we haven't soaked them, like you said, naturally ourselves, then now we're introducing into our body all these lectins that are causing inflammation. And so if our gut is already not doing well, then we're just causing havoc and then just feeding the problem more so.
Okay. Can you have nightshade vegetables on the SCD diet?
You can actually, but it's just more so going back to which ones are considered polysaccharides and which ones are considered monosaccharides. So there's still very minimal amount. It's not a ton that you're thinking, oh, eat every nightshade out there, you know.
Well, because you think vegetables and you think all vegetables are healthy. So when we're looking at, let's define nightshade vegetables: tomatoes, eggplants. What else am I missing? Potatoes, green peppers are considered nightshades. Are considered nightshade vegetables. Chili pepper is considered a nightshade vegetable, and I know that those can cause it helps stimulate an inflammatory process. And I think I wanted to get your take on this, because a lot of physicians will put people on an elimination diet where you're eliminating everything that we just kind of have talked about, and they go on a 30-day elimination diet, and then they can kind of reintroduce these foods. Is that what you do for your patients?
Usually I tend to do more of a food allergy test.
Okay.
Because people like to have hard numbers and, you know, not going to give up something if they don't think that it's necessary. But if we weren't going to do any kind of laboratory testing, then doing an elimination diet is ideal. I would probably go a little longer than 30 days though, because you know, the body needs a little bit more time to, you know, clean things out and then be able to reintroduce those foods. But yes, that is, you know, one way to go about it, no doubt, removing the foods and then reintroducing them just to see how you are reacting to it. Because you might have noticed that in the past you were fine to eat that tomato, but all of a sudden now, when you clean out the white noise, so to speak, you're seeing that you're getting a headache, a mild headache. And you always thought that mild headache was always there, but now that you've removed that tomato and now you're reintroducing it, now you know who's the culprit. That tomato has always been the culprit of that constant mild headache you've been having.
What about eggs? We haven't talked about eggs.
So eggs are not a problem on there. I personally didn't do as many, just because I had, you know, an egg allergy. And so I wanted to go ahead and remove them for the time being, just for my practical purposes on doing what was best for my body. Because even though the diet was still very general and has specific guidelines, I also needed to understand what worked for me as a person. You know, that's how treatments are usually done anyhow with practitioners. Is okay, well, you may be able to eat, you know, a tomato, but your significant other or your offspring can't. And so you want to go ahead and individualize that treatment.
With my business, with Legends Health Wellness Performance, we carry CBD, and because it helps stimulate gut motility. Where do you use CBD in your practice?
Oftentimes with autoimmune condition patients, where they're, you know, we're cleaning up things, and it's usually most people that, or patients that have already had, where we've cleaned things up. We've kind of, you know, cleared out the white noise. And so I've used it more for anxiety on some individuals, sleep on some individuals, others to just continue to heal the gut. And so there's different faces of the CBD oil that I've actually been, you know, suggesting it to my patients for.
Can you, in your words, can you kind of explain the difference between THC and CBD?
So with THC, that's going to be your psychoactive component, because that's where people always come to me. They're like, will this show up in my drug test if my employer decides to like do a test? You know, the CBD oil is not going to show that I'm going to be positive. And I said, no, because it doesn't have the THC component. THC is more your psychoactive component. You know, there's definitely some medicinal purposes to it, but then your CBD has just as many, you know, purposes, you know, that the THC does, but it doesn't have that psychoactive component.
So there's a Prop 2 that's coming up in the state of Utah. Are you familiar with it?
Yeah.
Okay, so what would you say to voters out there in regards to that proposition?
Well, I would definitely say that, we do need a medicinal proposition for introducing this very important plant. I think everyone gets a little, distracted and thinking, well, does this mean that we're going to have recreational? And the recreational is very different from the medicinal. And so medicinal is very important, as far as like recreational stands. From my understanding, at least in the prop, that's not dealing with the recreational part. It's only dealing with the medicinal aspect. And I think that's where people get caught up and lose the sight of what this prop is, thinking, well, now we're going to have everyone on the street corner, smoking pot. It's going to be okay. So let's say no to prop 2. At least that's where I'm gathering from individuals.
Now, have you done any research? Because a lot of people think it is a gateway drug. And in the research, my knowledge of everything that I've seen is it's exactly the opposite. It stops the opioid crisis. How many patients do you see that are under or taking a lot of opioids that you're trying to wean them off?
There's quite a handful, unfortunately. And so I tend to work in regards to pain in a different model where I have an acupuncture license. So I'm able to utilize that. I also do other things such as prolozone, which is going to help also with pain and then also regeneration of tissue. So it's in the regenerative medicine category, as well as the amniotic allograft transplant, which is stem cells also. So those are different things that I'm using in addition to lifestyle modifications to allow us to move away from the opioids. But as far as like it being a gateway drug, I don't see that being the case. I actually think sugar is more powerful.
We didn't even talk about sugar.
Sugar I think has a lot more impact on people because it's socially accepted. And so it's just funny how, people forget how powerful sugar is, but don't really put too much weight on it. But yeah.
Okay. What about let's talk about your acupuncture practice for just a minute. How do I say this? The majority of acupuncture patients that actually come see you, what does it work ideally best on? Maybe I should say that when you're doing, because you just said pain. So is it only used for pain?
It's not only used for pain. So I use it for pain, but I'm also dealing with a lot more than just pain. And so I'll use it for edema. I'll use it for anxiety, depression. I'll use it for any kind of GI dysfunction. And so during my time when I was also figuring out myself, I used acupuncture a lot. And so, I may be practicing it at the time I was a student, so I would be constantly making appointments for myself. And I felt that acupuncture helped me the most, because we were able to regain balance and to also stimulate natural healing in the gut. And so it is a great tool for anything and everything. And so it's just a matter of what it is that the person is experiencing and what we're trying to achieve. And so that's why I always recommend, if someone's going to get acupuncture, to go to a licensed acupuncturist, because they have the knowledge base versus, just a practitioner that took a weekend course, versus, an acupuncturist who does know this medicine in and out and understand the principles and how to, tailor the treatment for the person. So we're not just treating just pain, it's much more than that.
For me, I have 3 of the 4 genes that don't turn off inflammation in my body. And so I will get Achilles tendonitis and plantar fasciitis. I'll just inflame right there where I can't actually get out of bed in the mornings because I'm just on fire. And I did acupuncture. So it was interesting that you just said edema, because I'll swell in my ankles and I'll swell in my cheeks. I'll get swelling in my cheeks. Those are the 2 places that I notice it right off out of the gate. But this makes it so I can't walk. And I know when I've done acupuncture for my Achilles tendonitis, it was like I could breathe and I could walk out, because I felt like it really did release the inflammatory response or kind of help activate it to help my body eliminate it. So I'm so grateful for acupuncture because it takes me right. It gives me an additional something, to help release it. Because I'll be to the point that I can't even walk down to the hall to go to the bathroom, that my Achilles are so inflamed.
Yeah, that's not good. But yes, acupuncture can do, and it works really, really well for acute cases.
Yeah. Oh, yeah. No, it does. It does.
It does. So it's just nice to hear that someone else is, embracing, traditional Chinese medicine. So.
Yeah. Okay. Is there anything else that you add to your practice? You mentioned prolotherapy. Is there anything else that you do?
So, I'm thinking, I think we might have covered the majority of it. So, I do a lot of prolozone. So, prolozone is very similar to prolotherapy, and that's regenerative medicine. And so, in that category, we're looking at therapies that are stimulating the natural, the body's natural ability to heal. And so, that's where we're seeing prolotherapy, which is looking at, adding a dextrose medium to create an inflammatory response, but more of a controlled one. And that stimulates also the ability for those tissues to regenerate. I do prolozone, where I'm actually utilizing ozone gas to stimulate the natural body, ability to heal. And so I've seen patients who come in for, shoulder pain. I'm going to use one particular patient as an example. She had shoulder pain for, I want to say 10 years, she told me. And it was during my medical residency. And so she's like, you know what, I'll go ahead and try it. Because I'm like, hey, we could do prolozone to see if that maybe can help. And so it was after 2 sets of injections, each about a week apart, that she got significant relief. So she's like, okay, let's try another part of my body. And then for many years, I didn't see her until she found me again, just recently. And then it was about maybe 6 months ago when I had seen her again. And so I asked, like, hey, wait, I want to ask, how's that shoulder doing? And she's like, oh, I haven't had any problems since. And so it's all dependent on the person and how it's going to work. But that's just how powerful these injections can be. And there was no reason to do any kind of steroid injection, or any kind of surgery, because the prolozone was able to help her significantly. So.
Okay, I'm going to ask you one more question. James Maskell, he does the functional medicine, evolution of medicine, and he's asked his guests, if we were to start healthcare from scratch, what would that look like? So I'm going to ask that to you.
So if it was from scratch, diet, and fixing the diet, I think, is where everything starts, but a lot can be fixed. So, inflammatory responses start with a poor diet, a poor, internal environment. So is that quite answering what you're looking for?
Well, that we probably needed to train conventional medicine, because conventional medicine only gets about 16 hours of nutrition training. They hardly get any. So we would, if we were to start healthcare from scratch, we'd probably add more nutrition into our physician training.
Exactly. Because when I was still in my first year of med school, one of my really good friends, he was going through conventional medical school. And so we both, had done research together. We were in the same hospital. We were at Cedars-Sinai Hospital. And then after that, we went to Amgen together. And so when we both decided to go to med school, I went more the naturopathic route, because that's always what I wanted to do, in regards to just seeing how medicine, functions. And so he went the conventional route. And I remember my first year, because we would talk a lot that first year, because it was just so hard, and family just didn't quite understand. And so I remember talking about how challenging I think a nutrition course was. And I don't remember which nutrition course it was, because there were so many. There was from day one of naturopathic medical school to the last day, we were being taught and bombarded with nutrition. And so I remember just expressing my frustration on how challenging it was. Then he's like, wait, why are you guys spending so much time on nutrition? We only had 1 semester and we're good. And I was like, wait, 1 semester? That's the foundation of everything. I'm like, how is it just 1 semester? And so anyhow, it's just different. And so if we're going to change things, I really wish that the healthcare system would really embrace how powerful food is, and then be able to understand it. That gastroenterologist that I saw when I got diagnosed with Crohn's didn't even talk to me one thing about diet and nutrition. You know, he's like kind of like, eat whatever you want, you know.
Are you in remission now? We didn't
Yes.
have, okay.
Yes. And so it
And
doesn't.
and that was, you attribute the majority of that to diet changes.
Correct. And so that first year and a half, I was very strict. And then after I had gone, you know, the follow up with another colonoscopy and EGD, when I saw that things had healed, then I was able to relax a little. I'm not saying relax that I was all of a sudden eating everything under the sun, but I was able to then start reintroducing some grains back because I knew that my body would be able to handle them a little bit more. I'm not introducing everything, you know, I'm still doing gluten-free and dairy-free, but yes, that first initial probably year and a half was very critical for me, that I made sure that I did everything to the T. So.
Okay, so you're in American Fork. How do people find you? If they want to come visit and see you, how do people find you?
Yeah, so people can go ahead and find me on my website. I have my original website, which is drcarmelferreira.com. I know that's a very long-winded name. And there's also Empowered Healing Center. That's a little easier to remember. So that's the name of the clinic. And both websites have the same information. So that's one way to get a hold of me. If you're on social media is very popular now. So you could definitely find me on Facebook, EHC Utah. It stands for Empowered Healing Utah. So that's the name. And then same thing with Instagram, EHC Utah. I do have a physician account, so then there's Natural Doc that you'd be able to find me. So I stay pretty active there. I don't really do Snapchat. I'm sorry. But
you can't keep up with it all. You can't keep up with it all.
I can't.
Well, thank you for your time today. And
thank you for having me.
Yeah, no, you're welcome. And appreciate all the knowledge that you shared.